at least in the healthcare. Traditionally, there are many approaches to attain such goals. Like from the governmental side, there are some projects like Official Development Assistant, or we call it ODA, that traditionally when economically or technologically like more developed country, they would launch official assistance to those countries that are less developed in a specific group. So for example, we might be familiar with some of the European country or American country provided their personnel, or they send doctors or teachers to some countries in a specific part of the world, usually global south or global east part countries, to help them set up their own education or healthcare services. That's more from the governmental side. And we also know that there are some international NGOs project, like more of resource donation or also personnel dispatching. Such concept is actually, I think we are all very familiar with such concept. And international organization like Doctors Without Borders, MSF, or like Red Cross, ICRC, there are more of the products of the traditional concept of global cooperation, especially in the healthcare and human rights issues. But in the recent years, especially during the period of COVID pandemic, there's a quite obvious situation which we call reverse globalization, when in the past, countries or governments, they're trying to achieve a international or global connections or community so that they can actually like exchange what they have and try to be more mobile in terms of resources and personnel. But during the COVID period, as we can see, there are many travel bans and also resources issue ranging from mask production shortage and also oxygen issues, which is also a problem in India, as we observed earlier. Um, Also from that to healthcare personnel, mobility and also service, and even the certification or recognition of their professional services. Um, we are experiencing a situation that each country are getting more protective of themselves and trying to set up a more exclusive regulation against international mobility for such resources and like either products or human resources in the case. Um, from my experiences and my own observation, global cooperation somehow is more important in this case. And we also see an experience that healthcare, like health in all policies. So what we are trying to achieve, or we need to ensure is that we need to make sure things or the important topics outside COVID issue should still remain in the political agenda and that attracts enough attention at the international level. For example, what just happened in Palestine and what has happened in many different countries with the human rights or gender issues, they may not be as sexy issues compared to COVID or pandemics, but they are still impacting our lives in a more severe way compared to the days when COVID were not there. So I think I'll stop here. And I believe Matthew will also share some of the interesting interaction on this.
Thank you. Thank you, Pochin. He gave a very good summary as to what global cooperation in healthcare means. And before I start, I must also thank the NGA and also MSIs and IFMSA NMO for their kind invitation to this session, and also congratulations on your 10th anniversary. So in response to the question, what does it mean by global cooperation in healthcare? I think it really goes down to the fact that healthcare, health as a broader concept, and the care, so the delivery, and the challenges associated with health doesn't stop at a country's borders. And this can range from communicable diseases such as COVID-19, um, more in terms of more currently what's going on around the world, and also more traditionally non-communicable diseases such as cancer or cardiovascular diseases, etc. And even if we go a step further in its health administration, in our responses, in our delivery, and even taking a step back into the research processes and going to the nitty-gritty of how of these health challenges and tackling it from an academia perspective, these things do transcend borders, and that's why we need global cooperation in terms of our solutions. So because the problems are global, our solutions also need to be global. And given the current COVID-19 pandemic, I was thinking of certain examples of global cooperation in healthcare. And I think one of them that is a brilliant example of cooperation is just sharing the open data or open access for genomic sequences that are really allowed for, with the release of the full genome data, allowed for a lot of researchers to go ahead and in particular research and procure vaccines that are being distributed around the world right now. However, with this, it also comes with a lot of challenges within global cooperation in healthcare, particularly in the context of COVID-19. I think we see an increasing nationalistic ideologies and competition rather than multilateral efforts. And not only, so this is given the backdrop of originally the geopolitical tensions that were originally here prior to COVID-19. And a lot of them have countries which understandably are prioritizing their own citizens with, for example, vaccine procurement processes and getting enough vaccines for their own citizens, but also kind of overlooking the concept of global health equity and inequity with regards to vaccines as the most contemporary issue. But from this kind of gap, we also can see that different IGOs and non-state actors and NGOs in particular have emerged to fill these gaps in the cooperation of healthcare on a global setting. So one example of this would be Gavi in terms of the and how they're looking at vaccine diplomacy and ensuring that there are at least some supplies for lower middle income countries and countries who are traditionally thought as from the global south to have access to vaccines. And with regards to how the efficacy and effectiveness of the COVAX facility, that's for another issue, another topic in another day. But there are some efforts that provide that interesting confluence of public-private health diplomacy as well. And the second problem that I think within the global cooperation in healthcare that I can think of is also a pre-existing problem, and it's kind of the gap between the world of academia and research and also the world of healthcare policy and management. So as I mentioned from before, there's research that happens on a global level because our issues that we research about are global. But also the policy, so how we tackle these issues, are also on a global level. And we can see that in theory, there are a lot of things that happen that can work. And that happens in our research. So let's say there's plan A, but we often see what happens in reality. So what happens in the political arena is often plan B, C, D, or even E. And so with that, there are also many realities of the political processes that need to be taken into account. The most obvious being vested interests or the multiple and crowded stakeholder field that we have, particularly in the global health field. So there are a lot of things to discuss and discover within the potential of tackling our health problems on a global level.
Thank you so much. I feel that summarized the entire scenario of global cooperation in healthcare quite well, and I'm sure that the members got a very good and basic understanding of what we mean by when we say global cooperation in healthcare, and where do we step in and how do we uh, help in making it more impactful, like in making that chain more impactful. So thank you so much again. The next the next question which I would want to ask is to Pochin. Considering IFMSA is, as I already mentioned, the world's largest student-run organizations with a network of 1.3 million medical students being represented. So, how do you think has IFMSA been working towards the global cooperation in healthcare and towards the COVID-19 response?
I'll try to summarize everything because, as you say, it's a huge organization. And I believe if I miss any part of our work, my colleagues in the TO will not fancy the idea of that part. But I also want to say that Matthew has kind of helped us categorize all the important issues that we try to focus on in the past period. IFMSA in its structure does not only deal with the public health sectors or public health part of this world. Our other standing committees on human rights and peace and also gender issues centered and also on the medical education wise, it actually helped us to shape many different policies or recommendations to different stakeholders in the world. And that is not just happening during the COVID period. IFMSA, if it is ever a valuable organization, is not because it represents the world medical students. It is more about that it altogether provides a sustainable youth perspectives to a high level occasions. Because sometimes when you are given such opportunities, you need to ensure that the perspective or the opinions that you are representing to a specific group of people should be authentical and at the same time pioneering in very many different issues. One of the dilemma or let's say a challenge we have been facing is how we see COVID-19 pandemics when we are dealing with the strategic planning or when we're doing the issue grouping, because international attention is like a total amount and being there. So when you want to address a specific issues, that means it's crowding out a certain amount of attentions or resources or human personnel, so their times and money. We have two choices. Either we make COVID-19 a new umbrella issue. That means everything can like kind of get a relations with COVID-19, and then we put those issues to all together with COVID-19, and then we try to make everything related to it. So it was always addressed and deal with when we want it to be. On the other hand, we need to ensure that COVID-19 is just a parallel issue to many other things. That means when COVID-19 finish or this pandemic is being controlled, we will go back to deal with those issues or the, let's say less urgent or less attractive issues uh, on the global discussion platforms. We haven't have a very confirmed answer on this because this is a tough issue, and what it is actually changing is how we grouping the issues or how we see different topics that we are always working on, like gender issues, human rights, and also medical education wise. A good example is that in the beginning of or the very early stage of COVID-19 pandemic, we have experienced a lot of shortage of personal protective equipment, which was not usually an issue, even though the shortage has been there. And when medical students are not usually required to be given or be equipped with entire set of such equipment when they're doing higher risk techniques or contacting to higher risk patients, although they should have been doing so, even there is no pandemic. So we are in this process kind of shaping a new concept for medical education guidelines. So I remember in May 2020, World Health Organization published a guideline, which was called the FMSA guideline. PPE should be an essential equipment for all the medical students to do their clinical education. And now, when we're at the second or third stage of this pandemic, and when we see vaccine should be an essential resource to help us contain or control the pandemic, we do not see this discussion or such guideline being discussed yet. It could be because of a complicated issue behind vaccine hesitancy, and also whether to be vaccinated should be an option or should be a right to choose. But when it is confronted with the problem of public health approaches, and at a bit higher level, when governments or hospitals or management level executive board of different organizations or different agency in the governmental setting, what is the necessary approach to limit humans' rights when we are trying to control or we are trying to react to a more urgent issue? So setting a boundary or helping the civil society to clearly identify what is a, let's say, authorization only at an emergency situation and what should be resumed afterward. Such discussion is important, and it happens in civil society. So NGOs like IFMSA or like non-governmental organizations, there are a lot. It is kind of our responsibility to evaluate the situations or evaluate those approaches addressed or taken by the government. Because I also want to address a kind of important topic is we talk a lot about new normal after COVID-19 pandemics, but what should stay as the new normal after everything, or when we say we recover from the pandemic itself? There are many compromises that we take in this past 1 year. Are they the shape or are they the module for the new normal, or they're just a temporary attempts or temporary way that we do things only because of pandemic? For example, for FMSA, we also need to think about if virtual meetings are to stay, or they are the new trends of how we actually do the international gathering, because we believe that new pandemics will be there, and what we need to do is prevent rather than to cure. So such things should always be on our mind. And during the pandemic, after the pandemic, it is at least IFMSA's concept or duties or what we believe should be a priority, that we always remind our peers and the public that the threat is not generated. The threat is already there, and it was amplified or it was indicated only because the system is not ready for another round of challenge. That's pretty much what we're doing as a student representative or youth representative in many settings. But for our members or medical students or even our national member organization, I would say FMSA itself is also a big platform for internship. Like we're in the internship of global health governance, which we don't usually have the opportunity to experience or to learn in medical school or at any national level organization. So for myself, I was the regional director, and now I am the president of this federation. So I get to deal with the political part, or the way how we deal with the regional issues and the international issues. Such thing usually is not very related to healthcare or medical science affairs. It's more like administration, how we run an organization, how we deal with the secretariat issues or administration financial issues. And if we don't have an organization, or if FMSA is not at this level, or it does not engage so many people or so many countries at large, we don't really have a place to experience or to learn such skills. And hopefully many of our predecessors and many of our colleagues, hopefully also Matthew here, one day will be the leaderships or also the staff at least in such international organizations, or they run the organizations like United Nations or World Health Organizations. They had such experiences running an international organization, or does they deal with politics in the health field or health topics? That's actually something we believe important, because we are not able to really campaign or advocate for what's professional issues without dealing with political agenda first, when it's a gathering of international political countries and consideration uh, all the time. And yeah, so that's pretty much what IFMSA has been doing, and we expect ourselves to also provide to our members and provide a model to the international society, some of our peer organizations or some of our stakeholders, to let them know that students are an important figure. So we are not just attending meetings during fancy times, attending fancy meetings. We are also a opinion giver or opinion share or a solution providers when there's an emergency occurring. One last topic is what IFMSA do is actually not that impactful. Like, I mean, we are impactful at international level, but what really matters is actually what our national member organizations do at the national level and at the local level. Because what we have seen in this process is that when we are combating a pandemic, there are many public health approaches, or there are many new concepts or many inconvenience that is actually necessary for our daily life. And at least what medical students can do, or our youth generation can do, is to ensure that people around us or the community around us are accepting such inconvenience or accepting such regulations as a part of their life during pandemic, or part of their future life when we are preparing for the next pandemic. So I believe what we see at the national level happening is actually more important, and FMSA will still try to be a guiding organization for our membership in each country or in different region. And that also point out an important topic, I believe, which would be a good point for Matthew to further clarify if he wants to, is how we actually address the diversity among different places. Because organizations like FMSA will need to deal with diversity of countries. And countries like India or countries like China's, United States, or any country, to be honest, there are diversity within their settings. So how we make sure that the international guideline can be localized or nationalized in a cultural acceptable settings is an important thing. And that's also the experiment for medical students to take before they officially inaugurated as the health ministers or as the leaders in the World Health Organizations. So that's my sharing. And I mean, that's my personal perspective and also some of the opinions that has been discussed in FMSA. We would love to also hear from you. So welcome with any questions or any discussion if there's any.
Thank you so much. Considering how difficult times have been, I feel that the work IFMSA has been doing has been commendable. And as very rightly said, that the essence of medical students working towards bringing a difference is to bring it from the international platform to national and local levels. So that was extremely rightly said. Uh, Before we move on to the next, before we move further in the webinar, I would love to introduce our president, Dr. Purva Prabha Patil, who just joined us for the webinar. Purva, over to you.
Thank you so much, and apologies for joining in between. There was something that came up, had to be dealt with. And thanks again, Matthew and Pochin, for accepting a request to be on the webinar. I have a question for Matthew, actually, considering that you've been working so much on the regional scale as well. And Asia Pacific happens to unfortunately be one of the most badly hit regions worldwide. How has AP region been working towards combating COVID-19, and how do you think the NMOs are doing also in this endeavor?
Yeah, thank you for that question. I think as the RD Asia Pacific for this term, I've really been able to witness individual members, our LCs, our NMOs work towards and adapt with, work towards solutions or their own ways in responding to COVID-19 within their own contexts, but also in terms of how it impacts the organizational structures and how their individual organizations are run. And I think a lot of what IFMSA has dealt with on an international level that Pochin alluded to just now in his response has also taken place in a lot of different organizations within the Asia Pacific region. And one of them, I think this NGA is an example of it. So converting something from a physical setting to an online setting and how that can play out to our strengths and whether we're able to bring that forward into the future and how to adapt the new mechanisms that we've implemented during the COVID-19, I'll call it a COVID-19 era, to a time where we can hopefully recover from this pandemic and bring the good things out of what we've learned, the good things that we've learned out of this pandemic. So I think going back to kind of the mission of IFMSA, it really is to bring together a global community of medical students at the local, national, regional, and international levels on both social and health related issues to shape not only our current societal context, but also to make our future more sustainable and more healthy for all of us. And as Pochin also talked about just now, as IFMSA, we are able to provide a youth perspective to a lot of different health-related and even non-health related issues in an international context. And I think on a national level, NMOs and individual members can also work towards the same goal of providing a youth perspective to the issues that they see within our society. So I think a lot of us, myself included, prior to working in organizations such as IFMSA or my NMO, I always thought that youth, or as a student, I didn't really have anything to contribute because these problems were beyond me. These problems were too intangible, and I just needed to focus on what was in front of me, on my books, my studies, how to be a good student. And I think particularly within the Asian context, that's quite relevant because we're very academically oriented and we have those perspectives to keep in mind with all the familial pressures and societal pressures. But after working in IFMSA, I think one thing that I really treasure or really think that IFMSA does a good job in is really empowering national and local structures and also individual members in providing solutions on a local level. So I think I hold the belief that context-based issues call for context-based solutions. And as I mentioned before at the beginning of the webinar, the health issues that we face as a global community are global, but how each issue manifests itself in various different cultures, various different countries, political settings, governance structures, they will vary. And so the solutions that will be needed for each individual issue, even though it might seem like an amorphous issue or something that is more blank, like a very general issue, such as right now, the COVID-19 pandemic, the issues that are needed for each individual, how each individual community responds to it will differ. And so On a regional level, we focus a lot on empowering individual members, and on national level and a local level. So this ranges from external opportunities. So firstly, on a regional level, we presented all our work related to medical education at the Asia Pacific Medical Education Conference at the beginning of the year. And so we presented things like our activities that I'll touch upon later, as well as the various different surveys and how we tracked medical education worldwide, and how the COVID-19 pandemic has affected our learning. Because as a student organization, of course, our primary focus or something that we can definitely focus or tackle is how things affect our education and how we receive it. And as I think as recipients of education, we can also be active contributors to education. So that's where we also play a role on a regional level as to how we combat these issues related to COVID-19. And regarding more broader issues on an external level, we organized various different side events, such as the one at the Western Pacific Regional Office, Regional Committee last year, as well as this year at the 10th EcoSoc Youth Forum. And both of them were heavily revolved around health inequity, and particularly how the youth can be empowered and what actions we can take. And I think this is also one of the main takeaways that I think this webinar can have, is what each individual, what you can bring to the table. And I think maybe we'll touch upon that later, because that's not the question that I've been asked. So I think also on a regional level, we kind of underpinned a lot of the COVID-19 themes into what we've originally planned. As Pochin mentioned, COVID-19 really appears anywhere or everywhere that we touch or talk about. So for example, in mental health, we already know that healthcare professionals, or those who are like medical students in particular, do struggle with mental health issues. And I think particularly within the COVID-19 pandemic, how a lot of us have to deal with not only changes in schooling or how on our exams that are quite unpredictable, but also the fact that we are healthcare professionals and to some degree, and that a lot of us have been required to help at the front lines, and that also takes a toll on our mental health as well. And taking it from a different perspective, how mental health affects vulnerable populations within our society. So those things we also want to tackle within, on a regional level, we have themed months that are tackling these related issues. And in the future, we also are planning on tackling a broader issue related to human resources for health and the healthcare workforce post-COVID-19, and how medical students and healthcare students view their own sector or their own industry after this really health-dominated conversation over the past 2 years. And as I mentioned, on a regional level, we have a lot of empowerment to do. So for a regional team, I work with 12 other amazing individuals who work on various different aspects to empower our national and local structures. And this mainly comes in a form of the national EBs, as well as the national officers. And one of the things that I think NMOs really can work on, and is something that is very tangible to the work, is our activities. And I think within the Asia Pacific in particular, we've traditionally been very strong in having really impactful and great activities that really target, find a problem statement and have a good target population. And this has not only been recognized on an IFMSA level, where we have been awarded Rex Crossley Awards, Activities Fair prizes, but also more importantly is the impact that we're able to make in terms of how our activities are able to educate people, how they're able to advocate for certain issues, or how they're able to build capacity for our members and our communities that we serve as healthcare professionals. And so particularly within COVID-19, I remember presenting something a while ago now 3 or 4 months ago about our work related to COVID-19 in the Asia Pacific region. And by November 2020, we had 33 national or local level activities that were that focused on COVID-19. And in total, we were able to reach more than 4 million people with those activities. And I think now with that extra push with, well, first with more time and also with more commitment into having those our activities on a national local level to COVID-19 related issues, I think those numbers, not in terms of the sheer number of activities or the number of people we're able to reach with the issues we want to bring up, has exponentially increased. And this really shows the potential and the strength of what youth can bring to the table. And we only touched the surface with these numbers in particular. And I think just from an organizational level or from a more macro level, this is what we can see. But on a local level or more contextual level, I hope that these numbers can really translate into impact. And this is where individual members can come in and play a role in the curation of those activities, or even just planning those activities and even volunteering or giving your say. Because I think at the end of the day, advocacy and change in the world doesn't stop. And so the world moves on. And so we have to move with it. And if it's going to move, we might as well play an active role in it. And I think this really goes to why we work for organizations such as MSAI, such as IFMSA, because we believe in the broader spirit, or there's a broader belief that we can do something better, more and something better than what we have originally confined ourselves to. Yeah, so I think last point that I wanted to touch upon that related to regional work is actually something that Po-Chin talked about previously, about how by targeting a lot of COVID-19 related issues within the past 2 years now, or 1.5 years. And I think these issues still need to be tackled, particularly within countries and contexts where COVID-19 situation, where the cases are still going, there's still deaths going, like happening around the world, and all the ramifications related to just a virus. So with that, I think there are a lot of health related issues that are put on the sidelines. Most prominently, I think one that comes to the top of my mind is planetary health and climate change. And this is something that is still happening. And and the conversation sphere or the arena is only so big. And as we are transitioning from tackling all these COVID-19 issues, I don't know, hopefully these can resolve soon. But as we transition to something after that, then what are we going to do with the issues that we put to the sidelines? On a healthcare delivery side, as doctors or medical students, the most obvious impact we can see is the compromised care for chronic conditions, such as the long-term follow-up for example, hypertension or diabetes, because if you're somewhere with a really bad COVID-19 situation, I think a lot of people will be hesitant to just go to the primary care doctor to follow up, and there can be a lot of complications on an individual level. But I think on an organizational level, or we would consider the broader impact on our communities. So sexual and reproductive health and rights, or planetary health, or mental health in particular, these things are just pushed to the back of our minds maybe. And I think these are something that to be considered moving forward, not only on a regional level, but also a national and local level as well. And I think I've spent a lot of time talking, so I'm going to hand over the floor back to Molly.
Thank you so much. Thank you so much for explaining it in such detail, and I'm sure that it gave a really great perspective to all the members and helped them come closer to the region. Um, with that, I would like to move on to the next question, which is basically that how do you think one can contribute as an IFMSA member to to this response, and bring that difference and make come a step closer in bringing the change we're all aiming for here. I think, Pochin, maybe you can go first.
Okay. I also asked myself perhaps this question sometime in the past few months and few weeks, especially when Taiwan is now also suffering from COVID, which is quite late compared to other places in the world. But I think it's sometimes we expect too much when we want to, like when we are doing different things or when we're in different roles. I would say that as a member of a huge organization in the world, something important is that you play your role properly. And that means you still try to learn as a medical student, you try to serve as a junior doctor or future doctor, and you try to take care of your classmates or your friends or family as a friend or a family. I think one of Matthew mentioned is about the mental health issues and how mental health started to be a problem, more of a problem during the COVID-19 situation is that the interpersonal interaction somehow could be a problem in many different settings, in many different areas. And also, there has been a research, especially in the Asia Pacific region, among the medical students. If you're interested to read that article, you can just approach Matthew for his research and the article. But we see that how medical students have such conflicts when they are the medical student, but also they want to deal with different aspects of the issues itself. So that's one, play their own role, try to be as normal as possible, although it's very hard when everything is different, but we still try to learn and try to have everything that we schedule ongoing, perhaps in a different way, but aiming at the targets and moving forward to the targets, I think is something that can help ourselves and help our community. I think that's the best strategy to respond to any change, to be honest, in our life. Secondly, specifically for members in IFMSA, I think compared to our classmates or our peers, we have way more international friends or national friends outside our city or outside our community. And that gives us opportunity to receive much more different informations and like more diverse source of information we need, specifically on these global topics, just like Matthew has mentioned. When the problem is global, at the global level, then the solution somehow can also be at the global level. And with the community or the network you have from IFMSA, I hope this platform provide you with some soft skills, but at least some also the interpersonal support in a friendly or in a soft way that can help you digest the stressful information that you keep receiving from social media or also press media every day. I think that also can help with how you see the real situation at the world at the moment. It's something that somehow can be difficult, but that's also why we joined or engaged ourselves to this international federation, because we believe this is an important thing to do at the different phase of the time. So that's my recommendation, and I would love to add more if there's anything come up after the inspiration from Matthews too.
Thank you so much. Uh, the same question I would like to ask Matthew for his views as to how IFMSA members can make a contribution here.
Yeah, sure. So I think just reflecting on that question, it really made me think of why I am here, like why I'm IFMSA regional director. And because I applied in the middle of the, well, not in the middle, at the beginning, or I was thinking in the middle of the pandemic, whether I could whether I would be able to contribute to such a federation, to the works of an international organization, and whether I really had what it takes. And what I gathered, well, I'm here now, so I've concluded that I would go for it. And what I gathered was that all I needed to do was just try and go for it. And things will just slowly run its course. And whether this is related to your concern about, oh, I lack knowledge, I don't know enough about this issue, then all you need to do is get your computer, get your phone, and Google, and research and learn about the issues that you're unfamiliar with. And whether if this is related to, for example, your lack of skill, I don't think I'm able to handle these processes or be able to work in an organization or in a team, then this is why we have capacity building programs in IFMSA and in NMOs. And so I found myself during uncertain times really dedicating myself, my time and my efforts by working towards a solution in a team with people who also want to work towards a solution and generating some sort of change. Whether this was a small change, whether this was a medium-sized change, or whether this is a large change, however you want to quantify it. But at the end of the day, it was better than still sitting at the sidelines and really just watching the world kind of fall apart / unravel itself. And so going back to the question about how as an IFMSA member or a member of your NMO, how can you contribute to the COVID-19 response? I think my recommendation is just go for it. And you will be rewarded and you will be satisfied and you will be genuinely surprised as what you can do as an individual and also within a group or within a team that you are able to work with and work towards something that's bigger than yourself. And going back to what I touched upon previously about activities, I think it really centers, I think that's how individual members and NMOs really can make an impact. And this goes from educating to advocating to building capacity and also campaigning for related issues. And so from my memory, MSAI has a lot of activities, very activities heavy and focused related organization. And for example, one that I can think of is your ABCD program and how that has been activity that has been running prior to COVID-19 but has made its own iteration or changes to specifically target COVID-19 related issues such as plasma donation and COVID-19 and encouraging COVID-19 recovered patients to donate their plasma. And so that's a very interesting thing in making a long-standing activity or successful activity and adapting it into a COVID-19 response. And obviously we have new programs and new activities. So for example, your COVID-19 vaccination program or I think there was a small working group for a COVID response about gathering enough supplies for the communities that you work for and serve. So those are really just, in theory, they're very, very simple because all you need to do is just gather a bunch of people, gather a bunch of friends and work towards a problem that you identify in a community. And you can't say you can't identify a problem because I'm sure there are a lot of problems in a community. And that's why we work. And I think this makes me think of, there's a Chinese saying that I can kind of translate into like, you always want to take one step and you'll reach the sky, but that's always a very ambitious. So it really, I don't really know how to literally, that's a literal translation, but what it really means is that people often try to be ambitious and want to go from square one to square 100 or step one to step 100. But you don't really need to go from nothing to a lot. And for example, you might think, oh, I'm just a mere medical student. I can't influence the prime minister and his governance or policies. But what you can do is influence your community. And that little change, can snowball into something a little bigger, in terms of community, but also in your passion and your dedication towards the issue. And maybe that can unravel itself into something bigger as well. So my recommendation would be to start from LC work and just go from there. And I know that from your NGA, you had workshops to build your soft skills, to build your capacity, and overall just contribute to your personal development. And so even if you say, oh, that's too much for me, then just really play your own part, be a good citizen, practice your own health protection controls, and be an advocate for health, because you are, in essence, a healthcare professional. Whether you're graduated or not, you are in this sector, and you should play a role in safeguarding the health of your community and playing a role however you see yourself fit. And obviously, lastly, I think you need to watch out for your own mental health and own physical health before you can help others. And yeah, so that's how I think you can contribute to the response. It's very easy. So just take the step.
Thank you so much. Thank you so much, Matthew, for that response. And I'm sure it was invigorating also for people who are who find themselves confused right now as to what they can really do to help. Thank you for just simply breaking it down so much. And that brings us to our next and last question for the day for both of you. Mental health indeed has been a recurring theme of discussion throughout the course of our NGA, and this panel is not an exception. We've talked about mental health in some way, shapes, or forms. And it's no secret that a lot of people on our team also at this point are facing a lot of mental health issues, just given how gloomy everything around is. And there's so many personal and professional difficulties that we find ourselves in, especially because of how badly this pandemic has hit us. And I'm sure that given the workload and given just how many things you're both also dealing with in one go, mental health considerations would be an important point of discussion. And considering just how many times we are asked this, it would also be helpful to know what strategies you are using to take care of yourself and to take care of your mental health. Something that our members could also draw from, and hopefully we can also draw from, given how stressed we feel at times. So we can first start with Poshin, and then we can go to Matthew.
That's a dangerous question to ask, how an EB member protect his or their own mental health problems. I think it started with two approach, at least for myself, and I mean, I'm still trying to get over many mental health issues, so I'll update you later if that's a useful approach, but I'm trying. And over the past few years, I think two steps work for me. The first is to recognize that there's a problem, because sometimes we don't even know what are the problems that are causing the issues or disturbance to our mental health. Sometimes we think it's an event, or sometimes we think it's a set situation. But if you don't go into the detail or go into the core reason of the problem itself, you don't know what to resolve or what to work on. So I think it's all the same, like everything's the same, like COVID issues, mental health, financial instability of your own life. You need to find the core problems, and then you can address it properly. The other thing I believe will be helpful is to identify the emotions. Because we have mental health problems, we can have different reactions, and sometimes emotions will block us from seeing the true mental health issues that we might have. We could be mental unhealthy when we're happy. We can be mental unhealthy when we are sad. We can be mental unhealthy when we are numb. So emotions could be a reflection of our mental health status, but sometimes it blocks us from addressing the mental health issues. So trying to deviate the two things and also try to name the emotions, I think both are very important for us to really address our own status. That's for it. And I think second thing is also to recognize the fact that mental health is not something that you can cure or something you can resolve with a schedule or something that, oh, there's no therapy, pharmaceutic therapy for, like, it's not a solely solution to that. So you cannot expect a timeline or expect a process to go through with such situation. And I think that is important for people who are suffering from mental health issues, but also those who are willing to support your friends or your family or whoever, people around you that is suffering from mental health issue. You need to, and like, don't rush yourself and don't rush people. Lastly, I think something also important is that as medical students, we know there are many specialties in the medical field, and trying to simplify mental health issue as mental health is somehow too simple. And we don't set all the illness into like head health or like chest health. You further identify them with different system or different mechanism, pathophysiology issues. So I think one day when we are more comfortable with addressing mental health in the public, we can have a more detailed approach to identify those problems. But by saying that, I mean, we need to acknowledge that we are not the expert of all mental health issues, or we are not ready to cure or to heal others' mental health issues. So supporting them doesn't mean assisting them to go through the process. It also includes helping them to find the right person or right assistant they need. And in the process, I think when you are supporting some others, it's also kind of a process that, you know, whenever you need help for yourself, you know what to deal with that. So I think that's mental health at a more individual level, and more academic discussion on mental health in the community or at the national level or like among the human beings. I think that's another level of discussion. And given that I know nothing about them, I won't provide my stupid knowledge in case I mislead you. But I believe Matthew has some study on that, and hopefully he will also share some of his insight on this.
Matthew,
Shall
over to you.
I go? Yeah,
Yes.
sure. So I think every time I get asked this question, I really think about how hypocritical our healthcare professionals are, because we advocate for health. So let's say like physical health to start off with, because that's more tangible for people to see. So for example, we advocate, like we tell people, oh, you need to sleep, like sleep enough, like let's say sleep 7 hours, 8 hours, you need to eat healthy, you have enough vegetables, you eat less fried food, and you need to do yada 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 yada. But we never do that ourselves. Like we put ourselves through a lot of those same things we tell other people not to. And I find that it's also somewhat similar for mental health. And we put ourselves in positions as advocates for health, but we don't always advocate for our own mental health. And I think from this, we really need to, like on an individual level, in terms of how you would safeguard your own mental health. Firstly, I would agree with Pochin in saying you need to recognize that, like, firstly, no one's perfect. And so you need to be wary about your own limitations, about where you are more vulnerable. And from that, more importantly, how are you able to fall back into support systems that are conducive for you to grow and recover from the difficulties and the challenges that you face from a day-to-day life. And from this, really knowing when to find help is very difficult, because not only is this a community and societal issue, but particularly within the health industry, it's very difficult to admit that you need help, particularly if you need help, like help related to health, because I think there's a interesting complex or concept in people's minds that because we are healthcare professionals, then we don't need extra help. When in fact, we should need extra help. So knowing when to find help, and also equally as importantly, when you need to help someone find help. And so that's on a more like targeting the downstreams. And so if you think about the preventative methods, how you safeguard your own mental health, it really goes to how you work on your day-to-day life, how you prioritize your work, your needs, and also having a general awareness of the health of your friends and the teams that you work with. Because just a simple act of really being kind to one another, being mindful of someone's limitations and what they're going through within their lives, and also being forgiving as to they might be going through something. So that's understandable that they're not able to do certain things at this time. But that doesn't mean that it undermines their entire work ethic or who they are as a person, because they are still strong. They're just going through, like, if let's say one person is going through some mental health challenges, it doesn't mean that their entire self-worth is really based on those challenges. So I think as just general human beings, being kind, being mindful of your community and the people that you care about, and even people you don't care about, that really goes a long way in terms of safeguarding other people's mental health. And I think the other things that I wanted to talk about, I think Pochin really alluded to it already, so I'm not going to talk more about that as well.
Thank you so much for that, Matthew. And I think I can attest to the kindness and patience fact, having worked with you over the last couple of months as well. And with that, I think we are at the end of our questions for the day. And I'm very certain that there are some strong messages out here that we can all take back home and learn something from. And I know that we are in very different time zones. And despite all of that, both of you made the time to come and speak to us and speak to our members. And it's been a constant source of inspiration for a lot of our members, needless to mention. So thank you so much for gracing us with your presence. And we do hope to keep hearing from you in subsequent events as well. With that, we can call an end for today's panel. And for the agenda for tomorrow, please feel free to log into our website and check it out there. Thank you.
Thank you so much for your time and organizing this event.